hi everyone. My name's Liesel and I'm delighted to be here today presenting with Jessica. I'm a project manager and a team leader within the Australian eHealth Research Centre at CSIRO, and there we work on all things digital health. And in my team, we have a focus on mobile platforms and sensor technologies. I personally have an allied health background. I worked in Queensland Health for 18 years across numerous clinical areas, health services planning, allied health education and training, and clinical redesign. At CSIRO, I have a focus on working on aged care and disability projects, and I play a lead role in helping our teams to work out their deliverables, but also their ethics and governance requirements. And I represent CSIRO on the Health Translation Queensland CCI Research Alliance. Jessica.
Thanks, Liesel. Hi, everybody. My name's Jessica Suna. I'm the head of e-research for Griffith University, and I'm absolutely thrilled and delighted to be joining Liesel and the HTQ team today to talk to you about research data governance. So firstly, I think I should let you know what is e-research. So e-research is a team that assists researchers across institutions with all of their technology needs. They help researchers do their research efficiently, effectively, and safely. And there's probably something very like it in the institution that you work with. A big role of my team is supporting data management across the university and advising to our ethics committee regarding approaches to data management. Prior to working in e-research, I worked in clinical research management for almost 20 years, and I'm a nurse by background.
Thanks, Jessica. Getting to know our audience. So next slide, please, Sarah. So who are you? We'd love to know who we're talking to today. So before commencing, we'd really like for you to take a moment, if you don't mind. Just on the next slide again, please, Sarah, we have a Menti code. And we also have in the chat, not the Q&A, but the chat, we have the link for the code in case you don't have your phones handy. If you wouldn't mind just taking a few seconds just to give us a word about your role that you're in, and it'll give us a little bit of an idea of why you're here today. So we'll just give you a few seconds to populate that. And actually, we should probably go to the next slide again, shouldn't we, in a few seconds, so we can start seeing those answers come through.
So you'll probably notice that Liesel and I are doing a bit of a more casual approach to the presentation today. Obviously, research data governance can be a bit of a dry subject, so we wanted to make it a bit fun, get some interaction, but also give you guys some really useful hints and tips for how to manage your research data. So it looks like maybe some results will be coming through shortly. Give it a couple more minutes or seconds. Here we go. Hopefully this works. We've had a little bit of tech issues this morning.
There's no good presentation without tech issues, Jessica.
No, that's right. That's right. Oh, we've got 51 responses. Yay. Oh my gosh, that's amazing. There's researchers, data managers, clinicians.
Whoa.
Oh, wow.
Look at it go.
That's very cool. Ethics committee. Hi, ethics committee member. Fantastic. Stakeholders.
Design thinking. Registries manager. I've been so looking forward to Jessica's talk on registries. We have students, startups. This is amazing. How diverse.
Yes. Fantastic. That's great. Well, welcome everybody. We're so glad we got a diverse participant pool. So hopefully some of you or all of you get something useful from this presentation. So we might move to the next slide.
Thanks, Sarah. So we're going to talk through our plan for today. So to begin with, we thought we'd talk about data and what is it. By the looks of the people who've popped responses in there, it looks like a lot of you will have a good idea of what data means, but something that we're quite keen to talk about are those definitions. I personally sat in a meeting recently, I said this to Jessica, where we were meant to be talking about healthcare directions at a very high level, and everyone just kept coming back to, but what do you mean by data in your definition? So we figured that was a great place to start. So Jessica?
Yeah, so let's talk about data. What is it? So I think often in research, there's a big misconception that data solely comprises of final data sets that our statisticians analyze to yield the study results. However, data is so much more than that. Data is a foundation of information. It comprises of measurements, observations, or facts collected for analysis, and it encompasses many different types and forms, and it serves as a raw material from which insights and knowledge are derived. And we'll go to the next slide. Cute little infographic. This is a bit fun. So showing this data is diverse. It looks different.
And I think I always like to think about, Jessica, when I came to CSIRO from a health background, I was kind of oblivious to, there are so many different areas that our scientists and researchers work across, and where I look at things like people's blood glucose levels and their temperatures and all of those, bits and pieces, there are people working across our organization who look at, dust particles and atmospheric ocean air, and things that I don't even think of as data. So I know I had to learn that too. And next slide, please, Sarah. So what is research data? So research data is the information gathered from various research methodologies. Its interpretation varies across projects, but in healthcare, it's typically quite sensitive by nature. Health research data is often complicated, and it requires governance from legal frameworks, policies, and principles to govern it. Next slide, please, Sarah.
Yeah, thanks, Liesel. So I guess what's data governance? What are we talking about when we say that? So while we might initially think of this as something like, there's a governance committee or a process, its scope extends far beyond. Research data governance entails a comprehensive approach to overseeing data across its entire life cycle, all the way from acquisition through to utilization and disposal. It encompasses all measures aimed at safeguarding data integrity, privacy, accuracy, availability, and usability. Next slide. So hoping that this works for us, guys, we want to show you a quick video from the Australian Research Data Commons, or the ARDC, and this gives a really good description of data governance. Now, if you're wearing headphones to listen to this session, the sound for the video might come out of your computer speakers, so don't have it up too loud and wake the baby or anything. Let's see if it works.
Sorry, Sarah, I think we need to go back one. We might need to go back to, yeah, that's it there. Thank you so much.
But precious things need to be handled properly.
And that's where data governance comes in.
Meet Catherine. She's a medical researcher. Catherine has heard from a colleague about a data set that could really help her project.
But there's a problem. When Catherine reached out to the organisation that conducted the research, nobody was certain about data sharing agreements or who even had authority over the data.
The data set also hadn't been de-identified. It still had things attached like names, phone numbers, even dates of birth of the people with whom the data was initially associated. It soon became clear that accessing the data set was going to be anything but simple.
It seems Catherine could be waiting for months.
Let's rewind that scene.
Meet Catherine. She's a medical researcher. Catherine has heard from a colleague about a data set that could really help her project.
And the good news? Effective governance has been applied. The patients involved in the initial research consented to further use of the data.
The data authority roles were assigned, making clear who's responsible for the data. Even better, procedures defined how it could be accessed and by whom. And in this case, all the personal information of the patients has been removed. In other words, the data was de-identified. So that meant Catherine could log into a secure portal and just download the dataset after meeting certain usage and licensing conditions. The defined access procedure was in line with the FAIR principles for research data, making data findable, accessible, interoperable, and reusable.
And by the way, that data was the missing piece in Catherine's research puzzle. The fact she was able to make use of it was thanks to good research data governance.
So what is data governance? In a research context, the term refers to the established rules that allow for the use and sharing of data. Data governance defines who can take what action upon what data, in what situations, and using what methods. Good governance means data can be used with maximum efficiency and impact while ensuring the rights of stakeholders are preserved.
Let's face it, the world is awash with data. Using that data responsibly requires a solid and sustainable framework, good data governance, a process that helps the wider research community maintain data integrity well into the future.
Good data governance relies on policy, roles and responsibilities, and procedures. Policy components are the high-level strategic decisions usually made at an organisational level. That could include things such as data retention and infrastructure policies, as well as links to relevant privacy legislation and codes of conduct. Roles and responsibilities are at the heart of good data governance.
The main role to be defined is the one which has authority over the data. Who's accountable? Who decides what can be done with the data? But when what happens when that person leaves the organisation? It all needs to be defined.
Procedures are the specific instructions which ensure policies are adhered to. These could include security procedures, quality processes, and how access to the data is provided.
Policy, roles and responsibilities, and procedures. The three critical components to data governance. We all know the value of data. This is the path to using data responsibly and efficiently into the future.
Excellent. I hope everyone enjoyed the video.
So let's distinguish between data governance and data management. And while distinct, they are also really closely intertwined, and one can't really exist without the other. So data governance significantly impacts various facets of data management, including ensuring data quality, managing data retention and storage, facilitating the adoption of the FAIR data principles, which encompass metadata, vocabularies, and identifiers, upholding the CARE principles for Indigenous data sovereignty and governance, adhering to the trust principles, there are so many acronyms that we didn't all know existed, for constructing data repositories, facilitating data access and sharing. So many acronyms. We'll go into a few more of these a bit later.
Next slide, I think. So what would good data governance look like? Effective data governance hinges on aligning the right individuals with the right processes and supporting them with the necessary technology across the entire data life cycle. Next slide, please. So when contemplating data governance, it's essential to consider current governance practices, which are already in place, the defined roles and responsibilities, data accessibility, sensitivity levels of the data, data ownership and location, storage infrastructure and data types, potential for data reuse, and identification and mitigation of associated risks. Next slide.
Data governance is not a one-time event. It has a research life cycle and lifestyle for us doing it, but life cycle. Yeah. It's just simply not that one-time event. It's these should be living things that happen across our research. So it spans the entire data life cycle with different elements coming into focus at different stages. And today we're going to delve a little bit into essential considerations for research data governance across this life cycle. We hope to provide practical insights and tips that you can readily apply in the real world to different scenarios and also in your own research. The initial phase, often considered the cornerstone of the data lifecycle, is the planning and design stage. And I know that as a project manager, this slide often reflects people coming to me going, so what are we doing? What's the plan? How's it all going to go? How's it going to work? Lots of panic often. Next slide, please.
Next slide. So one of the most useful things you can do at this stage is to develop a data management plan. Now stop it. I can hear you saying another form, another document. You say it's so much more than that. A data management plan serves as a dynamic blueprint for a research project. It details data creation, policies, access regulations, ownership guidelines, management protocols, facilities, equipment, and assigned responsibilities. But why is this necessary? I mean, I think for all of us, we know that doing a research project, there's lots of steps, and this is another one. But the importance of this is it's pivotal for ensuring the efficacy of a research project. It aids in the management of research data, facilitating efficient reuse. Historically, I think data management was often an afterthought, and this led to, haphazard approaches that were time-consuming and error-prone. Investing time up front to establish robust and user-friendly data management procedures can yield long-term benefits, where on the flip side, inadequate data management practices can result in catastrophic outcomes such as data loss or privacy breaches. Conversely, proficient data management is crucial for securing funding. So now places like the ARDC, NHMRC, and ARC mandate adherence to the Australian Code of Responsible Conduct for Research for projects seeking funding. So often this is a requirement of your funding now too. Next slide, please.
And Jessica, I was thinking too about the fact the very first time I was ever asked to do a research data plan, which was a couple of years ago now. I very much know better now, but back then I had absolutely no idea what they wanted. I had no clue at all. I made it up. I guessed. I was like, there are people on this thing. I have no idea what they're talking about. But I think that maybe the people asking for it, the particular governance committee, also didn't know because it got through quite well. So either I did a really good guess job or they had no clue either.
I'm sure you did a good job. You did a good job.
I think it was a bit of both. But so if we look at this slide, this is what data management plans really should encompass and all the things that we really need to think about. So a few important elements of a data management plan are here, noting that not all of these items are mandatory for all projects. You really need to tailor it to the type of research, the size of the research that you're doing, how many stakeholders are involved, how many diverse groups, etc. So they can be quite tailored. But elements should include thought towards backup strategies, assessment of existing data, overview of planned data creation, guidance on file formats, instructions for metadata usage, information regarding ownership, access and security, guidelines for data organisation and naming conventions, plans for data transfer and synchronisation, collaborative writing guides, version control procedures, data storage locations, instructions for data sharing, publishing, archiving and licensing, data destruction policies, and allocation of responsibilities. So it's a huge amount to think about, but as we said, they don't all need to be in there, but sometimes if you've got a really big project, you will have a massive data management plan. But it should be developed as early as possible in the research. And I think that the biggest thing in all of this is the word plan. Next slide, please, Sarah.
Absolutely. So data management plans are evolving from static standalone documents that, it's hard to see the utility of, to integrated tools that link various systems. Many institutions now have data management applications that integrate with other administrative data sets. Woohoo! So that's great. Machine-readable DMPs can expedite the provisioning of research tools, software and storage for researchers, and a well-crafted DMP can streamline data publication processes, especially during journal submission. So we've added a few links here, and these our slides will be available after the presentation, which give you some links to different useful DMP sources. So one of them is the UQ Research Data Manager. Some of you might already be using this. This is great. Griffith's Manage and Plan resources, some NHMRC resources, and also resources from the Australian Research Data Commons. So if you want to have a look after, go for it. Next slide.
So policies, there will be some people here who love a good policy, and there'll be many of us who find them very tedious and wish they didn't exist, but they do exist for good reason. And it is essential that we address policy and legislation in the context of research data. Firstly, we need to understand that research institutions have a responsibility to develop and implement policies and provide facilities and processes for the safe and secure storage and management of research data and primary materials. These policies serve several crucial purposes. They enable the justification and verification of research outcomes. They maximise opportunities for future research endeavours. They minimise resource wastage, benefiting both researchers and the wider community. Institutional policies really should encompass guidelines for managing research data and primary materials, covering aspects such as ownership, storage, safety, and access. These policies are applicable to all research conducted under the institution's umbrella and may be influenced by project funding arrangements. So think about your budget as well. Researchers are obligated to adhere to their institution's policies, relevant laws, regulations, and discipline-specific practices from the outset of a research project. Sensitive research data often falls into distinct categories, including commercially sensitive data, personally identifiable information subject to the privacy legislation, and data subject to classification regimes or export controls. Researchers must implement proportional security and privacy measures based on the risks associated with these data categories as outlined in their data management plans. Next slide, please.
Next slide. So here's an example of a few policies that you might find at an institutional level. I'd like to acknowledge the Griffith Office of Research for this, but also highlight that your institution will likely have a comprehensive library of policies, procedures, and governance regarding research data management that apply to you and the particular project that you're doing. So remembering that you're doing your project under the auspices of the institution that you're working with, you're using their facilities and storage, so you need to adhere to their policies and procedures. So some of the important ones that I might call out that are included in this table that are really useful, particularly in health, are things like the Hospital and Health Board Act 2011, which relates to access of patient medical records. Also the Public Health Act, the Privacy Act, and there's a few retention guidelines included here that reference special populations such as research in children. Next slide, please. So the next topic Liesel and I would like to address today is onboarding. So onboarding, in essence, refers to the process of integrating individuals into a research team or unit, whether at the project's inception or when a new staff member joins a team. Onboarding holds significant importance as it lays the foundation for effective collaboration and productivity within the research team. It ensures that new researchers or team members understand their roles, responsibilities, and the overall objectives of the project or the team. Onboarding relating to data management practices is crucial for several reasons. It ensures data handling compliance, helps to maintain data integrity, facilitates collaboration, promotes security awareness, and enhances efficiencies. Research teams in this regard can also benefit greatly from things like implementation of standard operating procedures or SOPs, which include onboarding processes for data management. SOPs provide clear guidelines and instructions for various tasks and procedures, ensuring consistency, efficiency, and compliance with established protocols. SOPs serve as invaluable tools for maintaining consistency, reducing errors, and enhancing our overall team productivity. Next slide. So an onboarding process for a research data management, in a new project typically involves several key steps to ensure that team members are adequately equipped to handle data effectively and in accordance with established protocols. Here's an example outline of what such an onboarding process might entail. So you might provide an overview of the project's data management policies, including data handling guidelines, storage protocols, and security measures. Review relevant institutional, state, or national regulations governing data management practices, and discuss the importance of data integrity, confidentiality, and compliance with ethical standards. At this stage, you'd also want to familiarise team members with data management tools and platforms that you use in your project or team, such as data repositories, version control systems, or collaboration platforms. Also doing things like providing hands-on training sessions or tutorials to demonstrate how to use these tools effectively for data organization, sharing, analysis is really useful. It's important to tailor your training to specific roles within the research team. So highlighting the data management responsibilities and expectations associated with each different role, because we do all perform quite different roles in the research team, each very important. For example, data collectors may receive training on data collection methods and protocols, while data analysts might focus on data analysis techniques and quality control procedures. You'd also discuss things like best practices for handling research data throughout the life cycle, from data collection and storage to analysis and sharing. And personally, I think that's one of the kind of the key areas of risk, particularly in health research, is where you're sharing the data. So where you're sending data sets to be analysed by your statistician, making sure you do the right thing with that data, making sure it's de-identified and you're using a secure transfer system. Also, you want to make sure you emphasize the importance of accurate data documentation, metadata collection, and version control to maintain data integrity and traceability. It's important to raise awareness about data security risks and common threats, such as unauthorized access, data breaches, or data loss. Making sure you provide guidance on implementing security measures such as encryption. So often I'd recommend people encrypt laptops if that's what they're using. Access controls, doing regular data backups, and these are really in aid of mitigating risks. Another thing to think about is establishing communication protocols for sharing data and collaborating with team members, including guidelines for file naming conventions, communication channels, and project documentation. It's important to encourage open communication, collaboration among team members to facilitate knowledge sharing and problem solving. So making sure you're giving team members ongoing support and resources to assist them with any data management challenges, because we all have them, and already questions that arise during the project. So if there's any way you can provide access to additional training materials, documentation, or expert support to ensure that team members feel confident and capable in managing research data effectively, that's also great. Next slide.
So equally important is offboarding. So at the other end of the process, offboarding an employee leaving a research project or team is also crucial for ensuring the integrity and security of research data. Proper offboarding procedures help safeguard sensitive information by revoking access to data repositories, analysis tools, and collaboration platforms. It also involves transferring any data-related responsibilities to other team members and documenting the status of ongoing projects. By systematically managing the transition of departing employees, research teams can minimise the risk of data loss, unauthorised access, or disruptions to project continuity, thereby upholding research integrity and compliance with data management standards. An important hint and tip, make sure there are at least 2 data custodians for each project to ensure sustainability in the event that one leaves. And I think both Jessica and I had talked about that. We both had examples of where that had happened and people got really stuck and couldn't access things. So it's really important to have that backup.
Absolutely. I think, Liesel, you're right. Yeah.
Yep. Next slide, please, Sarah. Approvals, Jessica.
Oh, yes, approvals.
Yeah.
So initiating a medical research project in Australia, and particularly in Queensland, entails navigating several rigorous approval processes to ensure compliance and ethical integrity. These processes typically or can include things like peer review assessment, which evaluates the scientific merit and validity of the research. Then ethical approval must be attained from one or sometimes more human research ethic committees to ensure that the research adheres to ethical principles and safeguards the participants' rights and welfare. Now, depending on the nature of the research and the people involved, you might also be required to do a Public Health Act approval to ensure the public health considerations are addressed adequately. And that's where I particularly mentioned the Hospital and Health Board backed earlier, that's something if you're doing a PHA, you might want to familiarise yourself with that document. Furthermore, go.
No, you go. Sorry, Jessica. Sorry, no, you go.
Oh, good. So furthermore, institutional approval, or what we call research governance approval, is essential from each of the participating institutions. So remembering research governance is about protecting the institutions, safeguarding the participating sites, ensuring alignment with organisational policies and their regulatory requirements. These approval processes collectively uphold the highest standards of research integrity, ethical conduct, and participant protection, fostering trust and credibility in medical research endeavours. Next slide.
Actually, Sarah, do you mind moving forward one more again to the tips slide, please? Thank you. And I was just going to comment, Jessica, there was a question that came through before that I did just want to touch on, sorry, while you were talking about approvals. I think that's a good place. Just in case other people missed it, a question came through around some of that legislation and whether it only applies to Queensland, but it's a really, really important point to think about. Some legislation is just Queensland, some is state-based, and some is national. So you really need to actually, that's part of that planning process, is that you really understand, get a good sort of feel for what areas your research is touching on. And certainly for us at CSIRO, we work nationally. So I've been caught out a number of times where I hadn't thought about, like, I'm based in Queensland, but the research we're doing is actually like New South Wales, and they have different laws on things. So yes, and another has just popped up around consent, about intersections. HTQ would like to answer this one. Sarah or Helen, did you want to know?
Any questions?
No, that's all right. We'll come back to it. I'll come back to that one.
Yep.
Okay, so tips. So here are some helpful hints and tips to streamline the approval process and avoid unnecessary delays or amendments. So firstly, invest ample time in crafting a detailed research data plan outlined in your research protocol. Avoid vague statements and ensure accuracy in describing data collection and storage methods that align with institutional policies. Also, stop and check if one research data plan will be sufficient, because if you are going to several ethics boards, essentially they might all be the same, but they might want it on a different template, or there might be an extra question, or so just you may indeed need to tweak different templates or add in particular things. So it's always good to be prepared. Secondly, if there's a possibility of reusing data in the future, integrate this into your consent form and get it approved right from the get-go. It just prevents the need to reconsent participants later. I've been there and done that too, and it's painful and costly for everyone involved. Thirdly, when collaborating with multiple institutions, utilize template contracts provided by people like HTQ or your institution's research office to expedite the approval process. This can save significant time and prevent really prolonged delays caused by custom contract negotiations. And sometimes you can't avoid that, but if you can avoid it, it's worth doing.
Absolutely.
Lastly, anticipate and budget for the costs associated with storing and managing large data sets, as institutional coverage may not always actually be sufficient. By implementing these strategies, researchers can navigate more efficiently and allocate resources effectively. So, sensitive data. Next slide, please, Sarah. What is sensitive data? Often confidential sensitive data can include identifiable personal and health medical data, Indigenous data, ecological data concerning vulnerable species, and commercial in confidence data. And actually, I think probably while you're talking next, Jessica, I'll have a look at this question that's just been posted, because I think it relates to that as well. So over to you, Jessica. Next slide, please.
Sarah. Next slide. So data concerning Aboriginal and Torres Strait Islander peoples demands meticulous attention to legal and ethical considerations, emphasising the importance of respectful management and sharing practices. Recognising the principle of self-determination, it's crucial to involve communities in managing their cultural heritage and data in ways that align with their values and preferences and encompass cultural, linguistic, and medical data usage. The ARDC collaborates with the Indigenous Data Network, or the IDN, to enhance Indigenous communities' technical capacity for data management, leveraging advancement in data sciences to optimise data collection, access, and utilisation for community empowerment. Given the sensitive nature of data about First Nations peoples, access requires often mediated levels, necessitating adherence to specific conditions. It's imperative for researchers, data managers, and custodians to respect diverse worldviews and manage information accordingly, aligning with cultural differences. Next slide.
A significant amount of work is underway nationally in this whole field. And if there's one key takeaway from today's session, it's this: prioritise genuine and meaningful collaboration when working with Indigenous populations. Take the necessary time to engage with collaborators, ensuring mutual understanding and respect, and utilise the wealth of resources available at a national level to support these efforts. Next slide, please, Sarah. On the next slide, we have a couple of useful links for some key people leading work in this area and people who are far better experts than us in the work in Indigenous space and Indigenous data. So I'd really, both Jessica and I, we spoke about this quite passionately when we were preparing for today, and we'd really encourage you to go and have a look at this and really think about what this means for the Indigenous people of Australia.
And can I also just interject there that HTQ will be running an Indigenous data session on our session 3 on the 16th of April. Just go to our website for further details.
That's
Perfect.
fantastic.
Thank you, Sarah. Next slide, please.
So just while we're thinking of that, I'd just like to point out that a lot of institutions that you might be working with, they will have Indigenous representatives and that type of thing. They'll often have in the university Indigenous researchers, and they're also great points of information for you to link in with to learn about what you can do and what you can do better. So don't be afraid to reach out to different specialised groups to get kind of feedback as to what it is that you're doing, and do it early in your research project. Now, something that you may, that you heard us earlier say, there are a lot of acronyms in this area. One of them is the CARE principles, and these are the CARE principles for Indigenous data governance. And what they do is they provide a foundational framework centred on collective benefit, authority to control, responsibility, and ethics. These principles emphasise the importance of Indigenous communities' collective benefit from data, ensuring that they retain authority over their data and upholding ethical responsibilities in its management and use. By adhering to CARE principles, Indigenous data governance fosters trust, respect, and empowerment within communities while safeguarding our really beautiful cultural values and knowledge. Next slide.
So moving away a little bit from data that we collect and talking about data that we lose and not in a great way. So it does happen, and more often than not, they are complete and utter accidents, but we would be remiss not to discuss data breaches. So if an organisation has a data breach, and it is an organisation that is covered by the Privacy Act 1988, so you know, there are certain agencies and corporations in Australia that have to adhere to that. There is quite a strict protocol that has to be followed, and fairly swift initial action has to take place. I highly recommend that you go to the website for the Office of the Information Commissioner to have a look through their information, as it is very comprehensive, and the link is listed on the slide there. It's the orange link. I've also popped underneath in green the NHMRC guidelines with Universities of Australia, where you can go and have a look at their statements on data breach. That's another useful link there. One of the reasons why it is so important to do all of the early planning too is so that you actually understand what a data breach is. And that's going to sound very dumb, but if you don't know what data is, you may not know you're breaching it if you lose it, if that makes sense. And you know, you're possibly thinking I'm overstressing this, but it constantly surprises us in health research what might be considered data that we are no longer allowed to pass on. And for example, we can no longer, gone are the days where we can say within a research project, I've got this, you know, I'm working with this person who's not a research participant, I'll pass on their email address. We actually can't do that anymore. We have to say, I will ask permission for that person. Like I would say, Jessica, can I please pass your email address on to someone? Even if it's out in the public, our privacy officers remind us that it's sensitive information. So, and Jessica, just going back, someone has also commented just in the chat, in the question and answer, about Maori peoples as well in relation to Indigenous data. And yes, it doesn't have to be just Indigenous. It could be, there are many cultures where that will adhere to, but again, the message is just make sure you do your planning around it, look into what you do or you do need to do and what you shouldn't do, I think is the key thing there.
Absolutely.
So just with, and going back to data breaches, I think we are all aware of the recent examples of Medibank, Optus. I think there's probably very few people who weren't touched during that time. And while important elements of personal data were stolen during those times, what I observed and what I've read time and time again around case studies of these is it's actually how people felt. Many people knew what they had to do. They knew they had to be watchful for their bank accounts. People went and turned on two-factor authentication. Those actions were kind of clear and people knew that, but they felt cheated. And that was the worst part about all of this. They didn't appreciate not being told the whole story quickly. And it was sort of like there was this afterthought about kind of following up the information of what was happening. So an example I can personally give is from one of our research projects where it was a very large project, but we actually lost 2 consent forms. And it was an accident. It was a pure accident. We had project officers out on the road. They were carrying lots of gear, and it just must have dropped out of somewhere. These 2 consent forms out of a huge pool of research participants. And what we ended up having to do was, it took 2 months from woe to go to complete this data breach. So for two forms, and the only information that was identifying on the forms were first name, last name, and signature. So thankfully we didn't have any addresses or email addresses or no contact information, that kind of thing. But what we did was, we notified our privacy team straight away. They helped us construct like a letter that went out to our research participants. Fortunately, because it was only 2 people, we actually were able to call them immediately and apologize and tell them what had happened. And fortunately, both of them were like, nah, we don't care. That's nothing. That's fine. We were very lucky in that circumstance, but we still followed the process and they appreciated it. And it was a bit of work for us, but it was worth it to have that trust. So, and I just one other personal data breach that I witnessed recently was I shall not name where, but there was a health clinic that my family attends, and they recently sent out information to the entire appointment list for a day. And I saw the email come through. It had everyone's email addresses on it, what I assume was their appointment list for that day. And I notified them and said, you've had a data breach, because I know this stuff. And they were like, oh, thanks. And they retracted the email and it went to everyone again. And I emailed them back and said, you've just done it again. And it was interesting to watch what happened, because there was no apology issued. They didn't follow the process, which I know they should have followed. But so, yeah, I think a lot of people don't know what they have to do. They don't understand that something like an email address might have someone's first name, last name, year of birth. There's lots of information in there. It's important. That's the moral of the story. So, Jessica, store and manage. Yes. Next slide, please, Sarah.
Yes. So now we're moving further through the data lifecycle, and now we're at the store and manage stage. So we've collected our data, we've done our planning, now we're storing. So effective data governance is obviously really important for research, but it also includes strategic storage and management practices. So think about your storage options. So you can use things like secure cloud platforms or on-premise service. You can tailor what it is that you use to what it is that your data is. So making sure that you select a data storage tool that is in line with the sensitivity of your data. So a good way to think about this, and usually when you're going through the ethics process, you'll get asked those questions in your protocol or in the ethics ERM about where you plan to store your data. Now, I think Liesel said this earlier, but I'm just going to stop and say it again. Don't copy paste in your protocol and write, data will be stored in a filing cabinet locked in a locked room. Everyone writes that. That's not probably what you're doing these days with a lot of your data. Really think about where what it is you're collecting and where it's best held. Like we were saying earlier, you want to make sure that you have a storage solution that not just you can access. So obviously making sure it's documented where it's stored. One of the other things I just thought I'd call out in particular here is when you're using research data, you'll have kind of active data management where you're collecting like a data set and building on it. And then obviously you have your final data set too. And the requirements for that are different at the different time points in your study. So whilst you're collecting your active data, you might be storing that in something like a REDCap or an online database. And you're really doing things like you're using like least privilege access. So only the people who need to access, who've been trained to collect that data, should be accessing that data while it's being collected live, if that makes sense. Keep that data separate from your administrative data, if that makes sense as well. So your protocols, all of your ethics documents and that type of thing. So retention policies play a crucial role in determining the lifespan of the data. So you've got to balance things like storage costs with regulatory compliance and research continuity needs. Equally important are permission protocols and ensuring that data access is granted, like I said, only to authorised individuals or entities, and this safeguards against unauthorised use or breaches. So this is just another practical tip, and I know we're getting close to time, but when you use things like Teams or SharePoint, just be really careful with who you're sharing it with, because one of the things is like inadvertent oversharing can happen with those types of platforms. So it's good to think about that. So does the whole study team need to see the active data set? Probably not. So by implementing robust data governance frameworks, research projects can maintain data integrity, compliance, and security throughout the entire data lifecycle. Next slide, please. So here are a couple of example infographics used by institutions. So this is the UQ one and the Griffith one to show data storage solutions for research. Most institutions should have something similar. If you aren't sure, reach out to your ethics, or if you have a e-research team or a library, the library are great sources of reference for these types of things. They'll have a really good understanding of what's what with data management. And to see if they have a list of recommended storage solutions for your research and the type of data you're collecting. Next slide.
So sharing and reusing data. And Sarah, can I get you to move forward one more too, please? Thank you. To the 5 safes. So the 5 safes framework breaks down the decisions surrounding data access and use into 5 related but separate dimensions. Safe projects. Is this use of the data appropriate, lawful, ethical, and sensible? Safe people. Can the user be trusted to use it in an appropriate manner? Safe data. Does the data itself contain sufficient information to allow confidentiality to be breached? Safe settings. Does the access facility limit unauthorized use or mistakes? And safe outputs. Is the confidentiality maintained for the outputs of the management regime? Next slide, please, Sarah.
Yeah, so Liesel and I think Liesel was particularly interested, and I was too, in sharing a little bit of information about data sharing. So in the last decade, it's become increasingly common for researchers to make their data available to others when they complete a study. So we're kind of entering into a stage in research, I think, where we've got to do more with less. And so reusing data is really important. So this is referred to as data sharing, data publishing. And in health, I think there's been a reticence to do this, but we're seeing it more and more, which is fantastic. Data sharing is growing mostly due to recent data policies from journals and funders where it's a requirement. Data sharing and data linkage are 2 different things. They're used in different ways, and both are important and useful. Data sharing involves information moving from one organisation or a department, individual to another, whereas data linkage is defined as bringing data together from 2 or more different sources, data that relate to the same individual, family, place, or event. So increasing amounts of health research are conducted through data linkage as well. The need and importance of sharing clinical and research data are associated with a plethora of barriers. As you probably know, it's not easy, but there's been a move to streamline processes and remove barriers in recent years. So one of the things that I thought I'd just really call out here is template data sharing agreements really make a big difference. So the one offered by Health Translation Queensland assists immensely with this. So this is one that in Queensland institutions can use if you're doing a project that involves maybe a university and a health service. It's great to have a look at and use the HTQ or the BDHP as it was previously known, template agreement. As does the establishment. So recently we've had some movements with clinical quality registries, and this was brought about by the establishment of the Australian Commission on Safety and Quality in Healthcare National Strategy Framework. And we'll talk a bit more about that later for clinical registries. Over to you, Liesel.
Thanks.
Next slide.
Thank you, Sarah. So yeah, the National Clinical Quality Register program is a vital initiative aimed at improving healthcare quality and patient outcomes across Australia. Through the establishment and coordination of clinical registries, the NCQRP, another acronym, collects and analyses data on specific medical conditions, treatments, and outcomes. These registries serve as valuable tools for healthcare professionals, researchers, policymakers, and patients, facilitating evidence-based decision-making, monitoring of healthcare performance, and identification of areas for improvement. By promoting collaboration and standardisation in data collection and reporting, the NCQRP contributes to advancing healthcare quality, safety and effectiveness nationwide. The government has invested $40 million over 4 years into this initiative, with one early output being the National Strategy Roadmap. And we've linked those resources for you here on the slide, and they're for those of you interested in doing research involving clinical quality registries. Next slide, please, Sarah.
Yeah, so they're a great source of research data for you. So in the area of research data repositories, trust is foundational, ensuring that data remains safeguarded, unaltered, accessible, comprehensible, and compliant with established criteria and standard. Trust encompasses the longevity of data protection, resilience against unauthorized alteration, readiness for user access, clarity and description for informed decision-making, and adherence to repository and community expectation upon deposition. Upholding these trust principles fosters confidence in research data integrity, reliability, and utility within the scholarly community and beyond. Next slide, please. So with this in mind, the Australian Research Data Commons, or the ARDC, has initiated the SANDA Health Studies Australian National Data Asset Program. This is to establish a national infrastructure to support access to sharing and reuse of health research data. The program aims to enhance collaboration among researchers, improve research efficiency, and ultimately benefit Australia's health outcomes. The research community across Australia has been working together through HSANDA to develop a Health Data Australia, which is a catalogue for health and medical researchers to register a description of their research so it's easy to discover, which is so important. Phase 1 focused on investigator-led and academic clinical trials, while phase 2, which is, I think, starting now, and Sarah, who's on the call, is a great contact for this. Well, phase 2 is really focused on expanding capabilities to encompass other health study types and deploy new features. The program is supported by 9 nodes nationwide, including Queensland, which is, as I mentioned, it's coordinated by HTQ in collaboration with CSIRO's Australian eHealth Research Centre and the Queensland Cyber Infrastructure Foundation, or QCIF. The Queensland node focuses on enhancing findability and accessibility of clinical trial data through a data repository, which is hosted by QCIF, and a data request system. It's funded by the ARDC through the National Collaborative Research Infrastructure Strategy, or NCRIS, if you've heard of that. So I guess what I really want to call out, if you're a researcher and you're thinking about sharing your data, the Queensland node will really welcome having a chat with you and to tell you a little bit more about it and how it can work and how it can benefit you. So please get in contact with the team at HTQ. Next slide. Goodness, I'm talking more. Okay, so FAIR. Using FAIR data principles can significantly enhance the impact of your work by facilitating early or easy discovery and reuse of your data. FAIR data principles are articulated through 4 key components. The first is findable, so ensuring your data discoverability through rich metadata and persistent identifiers. Make sure it's accessible, so enabling data retrieval by humans and machines with clarity on access conditions. Next, is it interoperable, ensuring common languages, formats, and vocabularies for data and metadata. And lastly, reusable, so providing detailed metadata, so descriptions of your data essentially, clear usage licenses, and provenance information for data reuse. Next slide, please. So in order to select appropriate storage, we've kind of gone a little bit through different things, but back to storage again, and transfer mechanisms for your research data, you first need to classify your data. And this is what Liesel and I were talking about earlier. So if your data is sensitive, if it's public. So here's an example data classification infographic developed by the University of New South Wales. And it helps you really determine, again, like we were saying earlier, what type of data you're handling and where and how to best handle that. Next slide. You'll probably see that a lot of research data in health is sensitive or highly sensitive in nature. Over to you, Liesel.
So I'm very conscious of the time, everyone. We've got 2 minutes left, so we might round up very quickly. We've only got a couple of slides to go, and this one's just it gives you an idea to be aware of retention of storage. So this is a Griffith one, but you can have a look from your own organisation, or some of them are associated with the national laws that you might be using. So have a look there too. And then I really want to flick to the next slide, Sarah, even if we just get through this one. It's really important, I think, that we talk about consumers in research. So Jessica and I, when preparing this presentation, really reflected on the importance on touching on consumers in the research team, especially in relation to data governance. So everything that we have outlined today applies to consumers who take on research roles as well. However, we did want to acknowledge that not all consumers will have access to resources as easily as some of us who work for like a big university or a health service or a research team. They may not have that backing that comes with their role. So our top tip here is to make sure that your onboarding and offboarding processes are tailored once you have an understanding of how experienced or not your consumer stakeholder is for your type of research. Take the time to really understand their background and skills, find out where they are comfortable or not, and where further points of education may be required to help them understand the data management that they'll be obligated to do or conduct. This will go a long way in also making your consumer stakeholder feel really welcome and part of the team. So we really recommend that you do that. I think we can jump forward 2 more slides, Sarah, if that's okay. And just a word on data access and sharing. They're integral parts of research collaboration, often necessitating agreements between parties, especially when extending beyond project or institutional boundaries. Secure file transfer methods are essential. We've discussed those a little bit. And it's just advisable that you really consult with your institution or your stakeholders' institutions on their requirements. Research data repositories, including both institutional and external platforms like Cassandra, are increasingly utilised for their efficiency in storing, organising and sharing data across disciplines. These repositories enhance data discoverability, accessibility and longevity, fostering collaboration and advancing research efforts. It's really important to consider archiving at the conclusion of your active data collection and analysis phases and ensuring secure storage of final data sets that are accessible, as we've said before, to multiple members, not just one. Adhering to recommended retention periods outlined by the ethics protocols is also essential, so definitely check those out. I would encourage researchers to consider using cold data storage platforms for infrequently accessed files, and your institution should also have recommendations regarding which platforms are best for this. Remember to update your data management plan to include information on where you have stored the final data set and who has accessed updating information as it changes. Next slide, Sarah. This is our final, really. And in summary, our summary points are: take time to think, plan your plan, talk to all your stakeholders and consider their needs, look at policies and legislations. So I think they're our hot takeaways for today.
Yes.
So Jessica, over to you.
So as we're finishing up this session, we wanted to ask you to take a moment, think about what you've listened to today and complete another online Menti survey, just to share what you might have learned that you didn't know about today or any insights that you gained during this session. What did you find the most useful? What didn't you know? So we should have popped the link in the chat.
I'm just doing this.
Otherwise, it's a QR.
Yeah.
If you want to use your little phone. Recognizing that we've gone over, but if you want to stay along, stay along.
Actually, Sarah or Helen, are you able to stick that chat in, that link in? Hang on. It doesn't look like
Helen
it's working. Yeah, it's not working for me. Sorry. Jessica?
Okay, that's all right. Well, maybe we'll just obviously we've gone over time, but I
let's
guess
see
to
if we
finish,
get a
we just really
couple.
wanted to, yeah,
We might get
thank
a
you
couple of
all for your
answers. Yeah, thank
time.
you. Oh, awesome. That's great.
And also just highlighting, Liesel and I provided our emails at the beginning of the presentation. You're welcome to reach out. You're welcome to contact the team at HTQ. If you have any questions, you just want to chat about data, please do. We'd love that. Anything else, Liesel? What are you thinking of?
I'm actually just looking at some of the responses, Jessica, and I've just noted they're all really good, except there's one in there I want to flag, which is I'm concerned about consumer data privacy. And it would be lovely to explore that more, but anyone who's concerned about any privacy, so it's not just when we look at privacy, we look at everyone involved. So we keep the privacy of the participant, the privacy of the stakeholders on the committee, whatever roles they're on. And that's what a good privacy plan should actually be, looking at all those aspects and be governing everyone. So if you have any concerns around that, I would certainly encourage you, if you are a consumer and you're associated with a project, bring it up with the team and ask them to talk about it, and go to their, like we have a privacy office. We're very fortunate at CSIRO. We have privacy lawyers who review all our work and tell us how to make it better and less risky and all of that kind of thing. A lot of the institutions do now. So bring it up with the team and have a look. But the governing for everything, really, the broad thing is looking at the privacy principles, the Australian privacy principles.
Absolutely.
And that's it. No, thank you for having us.